Immunosuppressants. Immunosuppressants mainly we are used to suppress the immunity. We all knows that immunity is very important to protect our body from foreign substances like microbes and all. But here we are discussing about the immunosuppressants. So why these immunosuppressants are required? So that and all we'll discuss in this video. Contents, definition, classification, mechanism of action, pharmacokinetics, adverse effects, and uses. Immunosuppressants. So these are the drugs which inhibit or prevent the activity of the immune system. So in the name itself it is there. Immuno means immunity, suppressants means suppressing, means the agents will suppress the immunity, those we called as a immunosuppressants. So these will suppress either cell mediated or humoral mediated or both. So why these immunosuppressants are required? So these immunosuppressants are used to prevent the resection of transplanted organs and tissues. So you know well that if organ is not functioning properly, for example heart is not functioning or kidney is not functioning, liver is not functioning, if in case of bone marrow transplantation, so either transplantation of organs or tissues, during the transplantation of organs or tissues, so our body has the immunity that won't accept the foreign organ and tissue, so it will try to reject that. So to avoid that rejection of transplanted organs and tissues, will use the immunosuppressants. So immunosuppressants are the agents which are used to prevent or inhibit the immune system to avoid or prevent the rejection of transplanted organs and tissues. So during the organ transplantation or tissue transplantation, to avoid the rejection, we'll suppress the immunity. For that, we'll use the immunosuppressants. Also used to treat autoimmune diseases. So we knows well that autoimmune diseases means the immunity mistakenly kills the healthy cells or tissues. So that condition we called as a autoimmune diseases. So to treat the diseases, we'll use the immunosuppressants. Examples for autoimmune diseases are rheumatoid arthritis, myasthenia gravis, and psoriasis. The last is not only to prevent the rejection of transplantation of the organs and tissues and autoimmune diseases, also to treat the non-autoimmune inflammatory diseases, will use the immunosuppressants. Example for non-autoimmune inflammatory diseases, chronic asthma. Classification. So these immunosuppressants are mainly classified into two types, non-selective and selective. Non-selective means these are the drugs which doesn't select any particular target receptor to suppress the immunity. Selective means here the drugs will target particular or specific receptor to suppress the immunity. So let me see what are the sub-classification of non-selective and selective. So these non-selective immunosuppressants are sub-classified into three types. The first one is corticosteroids or glucocorticoids, example prednisone. The second class will be antimetabolite. This also inhibits the DNA synthesis, we called as a DNA synthesis inhibitors, example azathioprine, and third class will be immunoglobulins, example anti-lymphocyte antibodies. So we know well that lymphocytes are responsible for the immune function because T lymphocytes and B lymphocytes mainly will access the immune system. So here we are using the anti-lymphocyte antibodies, means these are the drugs. So for that we'll use the immunoglobulins. So these are the immunoglobulins will suppress the lymphocytes so that we can suppress the immunity. So second class will be selective immunosuppressants. So in the selective immunosuppressants again classified into three subtypes. The first one is calcineurin inhibitors. Calcineurin inhibitors means these are the agents which inhibits the calcineurin. calcineurin is an enzyme. So this enzyme usually responsible for the activation of T lymphocytes. So by inhibiting this enzyme, we can suppress the T lymphocytes so that there is a suppression of the immunity. So these calcineurin inhibitors will target the calcineurin enzymes. Example, cyclosporin. Second class is selective interleukin 2 receptor antagonist. So, interleukin 2 receptor is a receptors. Usually, these receptors are involved in the activation of T lymphocytes through the signaling pathways. So, if you are using the antagonist for interleukin 2 receptors, we can suppress the interleukin 2 receptor and also we can suppress the T lymphocytes. So that here we are using the selective interleukin 2 receptor antagonist. Example, basiliximab. Then third class will be mammalian target of rapamycin. In short form we called mTOR. So this mammalian target of rapamycin is a protein kinase. Usually it is responsible for the suppression of the T lymphocytes. Example, sirolimus. So in all selective and non-selective immunosuppressants, here I choose the glucocorticoids. So in this video we'll discuss about the glucocorticoids. So how these glucocorticoids will suppress the immunity, so what are the adverse effects and pharmacokinetics, then uses of this drug. If you come for mechanism of action, so these glucocorticoids will bind the glucocorticoid receptor present at the cytosol. So after binding the glucocorticoid receptor, it forms glucocorticoid and glucocorticoid receptor complex. So this complex itself, it translocates into cell nucleus. So after entering into the cell nucleus, this will bind the glucocorticoid receptor response element. Glucocorticoid receptor response element in DNA. So usually this element is present at the promoter region of the DNA. So it will start the transcription. So this glucocorticoid will bind the glucocorticoid receptor at the cytosol. Then it form a complex. So this complex itself translocates into cell nucleus. So after entering into the cell nucleus, it bind the glucocorticoid response element at the promoter region of the DNA. So after binding the promoter region of the DNA, it makes a changes or alterations in the transcription and translation of proteins. You know well the transcription means synthesis of RNA from DNA, translation means synthesis of proteins from RNA. So the DNA, when it makes a changes in a DNA, for example, it wants to suppress the immunity, means it will affect the lymphocytes. So for example, it will affect the lymphocytes means the DNA will give us signals that it has to suppress the immunity. So when DNA during the transcription only, it will encoded that information to RNA. So during translation, the RNA will encoded that information to proteins, and proteins finally will express the DNA function, means it suppress the immunity. This is the mechanism of action. If you come for pharmacokinetics, so we'll study about the absorption, distribution, metabolism and excretion. So these glucocorticoids well absorbed orally. 70 to 90% of the drug are available at bioavailability, widely distributed throughout the body, and 70 to 90% of the drug bound the plasma proteins. So due to uh, 70 to 90% of the drug bound the plasma proteins, we can see a longer duration of the action. It is metabolized in the liver and excreted through urine. Plasma T-off is 36 to 54 hours for dexamethasone. Let me come with the adverse effects. So you know well that glucocorticoids are used for the immunosuppression. So when we are using glucocorticoids for immunosuppression, obviously it will cause the deficiency of immunity. Due to suppression of the immunity, so our body will face the immunodeficiency. Then also it cause hyperglycemia. So why it will cause hyperglycemia? Because glucocorticoids will cause the resistance to insulin. Due to insulin resistance, it causes the hyperglycemia. Also it causes osteoporosis. So you know well that osteo means bones, porosis means formation of pores. The formation of pores in the bone we called as a osteoporosis. So why this will happen means glucocorticoids will suppress the bone growth. So when it suppresses the bone growth, the calcium deposition in the bones will be reduced. So then due to weakening of the bones, pores will form, and what are the things are there, it will be come out. So the bones will be fragile, it will be weak. Also it causes weight gain. So why glucocorticoids will cause weight gain? Because it increases the appetite, and also it will make alterations or changes in the metabolism, so that weight gain will happen. And due to suppression of the CNS, it cause impaired memory and deficits. And also it affects the growth hormone, so that it cause growth failure. And also it cause glaucoma. So why glucocorticoids will cause glaucoma? Because it increases the intraocular function. So due to increase in the intraocular pressure, it will cause the glaucoma. And also it cause cataract. So why this cataract will form means, usually the cells present in the lens, so that will be go for apoptosis due to oxidative stress. So these glucocorticoids will cause the oxidative stress, and cause due to oxidative stress it will cause apoptosis or death of epithelial cells present in the lens, so that it cause the cataract. Let me come with the uses. So these immunosuppressants are used to prevent the transplant resection, means it is used to prevent the resection of organ transplantation. And also it is used to suppress the various allergic, anti-inflammatory and autoimmune diseases. Autoimmune diseases like rheumatoid arthritis, psoriasis, etc. So these inhaler glucocorticoids, Budecart, generally we used to see that rest pools and all. So this Budecart rest pools and all, Budecart is nothing but glucocorticoid. They are used for a second line treatment for asthma. And also low doses are used in case of adrenal insufficiency. So when adrenal gland is not working properly, that time we'll use the low doses of the glucocorticoid, because it's a steroid, so it will maintain the adrenal function. During heart failure, we'll use the glucocorticoids to increase the renal responsiveness. So these are the uses of glucocorticoid. Thank you.